I'm Dr. Aseedu Kalik. I practice internal medicine at 1200 Breckenridge at Owensboro, Kentucky. This is Owensboro Primary Care. I see a lot of COVID patients, and there are quite a lot of questions I encounter day by day. And also about the vaccine. Since I had been quite used to explain to my patients about the disease and the importance of disease prevention and also the vaccines, since I had been doing one-to-one all alone all this time, I thought it was more appropriate to give a little bit of video clip for my patients and also for a general public, which will immensely be useful, I suppose. Before we starting off with this, it is RNA virus. It is spread by mostly droplets, and also through that touching and also from the places where you touch a virus, stuff like that. And people can be carrier a few days before the symptoms, and also the people start having a symptoms from the day 3 to day 10. So even if you are exposed to the virus until 10th day, you will not have a symptoms. I think in that sense, I like to give my own experience since I had a COVID infection somewhere around November 1st week. My son was positive on Friday. After almost like a week later, I got positive. So you could imagine if I had not been taking a precaution, I had been spreading a disease, even though immediately when the health department conveyed the message that my son was exposed, I started quarantining myself at home along with my kids and my family. So this is what I think I expect my patients and also whoever really care about the COVID-19 to be doing it. Let me explain about the symptoms and which I went through. Initially, I had some sore throat, and then I started having a headache. After about 4 days, I woke up with a severe short of breath and a cough. I had been practicing medicine in this place for almost like 14 years. I can't even remember a single day I got a day off or take a sick day off. Usually I just brush it off overnight and come back on the following day to work. But when I got a COVID-19, guess what? How many days I took? I had to stay home for almost like 2 weeks because I have a severe short of breath. Sometimes I may be breathing and suddenly I have to take a something like that. You'll be amazed. It is not a fun to have that kind of experience. You will never know what's going to happen to you. And also, my 4 members were sick. So even though I taking some Tylenol and also some normal remedies, like I have some cough syrups, but I did not feel good. So apparently I had to talk to a doctor who is working in the hospital on a COVID unit, and I had to take some special medicine, a steroid. I had to take it for 10 days before I got better. So take this serious. I know this is a disease. It can put you down. And my own experience by talking to my patients, I can tell you almost more than half of the patient population has told me that some of their family members had been sick with COVID-19 and they had a problem. And also, I have many patients who comes and tells me the family members they have lost. So be serious about the disease. Mask is very, very important. Hand washing if you are going somewhere else is very important. Hand sanitizer if you happen to touch is very important. If you don't have a hand sanitizer, hand washing is very important for 20 seconds with a soap and water, with a running water. That's important. But the good news is the COVID vaccine is available in the United States. We have two kinds of vaccines available right now. One is Moderna and also the Pfizer. It's almost both of them RNA, mRNA vaccine. You could talk to your doctor if you wanted to know about it, or you could log on to CDC website. You could read more about it. Pfizer vaccine, you have to, it is 2 doses, both vaccine. Pfizer has to be given first and 2 doses 21 days apart. And Moderna vaccine has to be given 28 days apart. In my clinic, so many of my patients got it. There are few people even got the second doses. The people who got the first doses, the main complaint with them is a soreness on the site of the injection. And that's mostly it. And maybe one patient I can remember was complaining about a cough. And I listened to his lungs. When he came to the office, he didn't have any other lung symptoms. So the first shot, most of the time, the soreness on the site of the injection is some redness, which will last maybe 3 or 4 days. Eventually it goes away. With the second dose, most of the time, people complaining about a little bit of headache, muscle aches and pain. That's mostly, there are people who complain. I think maybe 1 or 2 patients out of whom I talk to quite a lot of people. Even my friends who is in United Kingdom, in England, who has taken a Moderna. There are people, they said it lasted almost a half a day and then they were absolutely okay. The first dose, very mild symptoms. Second dose, a little more symptoms, might last maybe 24 hours sometime. Maybe a little bit of more headache, muscle pain and muscle aches and pains. And I haven't come across anybody got more sicker. So this is the information I gathered, because this is my own experience I gathered from my own patients. But if you scared about it, you could always talk to your doctor. If you have some allergies, make sure you talk to the doctor before taking a vaccine. My patient always talk to me. I go through that every day. If you have more questions, always talk to your doctor. That's the best option. And this is not a mandatory for everybody. It's your personal choice. Nobody going to force you. But vaccines are running out very fast. I have patients who had been waiting for 2 weeks. So if you are deciding to take a vaccine, make sure you call the hospital nearest and they'll find out what kind of vaccine they have it, how quickly you could have it. And that's all about it. Always talk to your doctor personally.